Good morning and welcome to the 7th meeting of 2026 in Session 6 of the Equalities, Human Rights and Civil Justice Committee. We have no apologies this morning. Pam Gossell and Rhoda Grant are joining us remotely. Our first agenda item is to agree to take agenda item 3 in private. Agenda item 3 is a consideration of the evidence we will hear this morning. Our members agreed to take this item in private. Yep, we are all agreed. Thank you. Our second agenda item this morning is to consider the findings of a joint research report on the perspective of deaf mothers and signing practitioners on domestic abuse, communication issues and the impact on deaf families by Professor Jemina Napier, Dr Claire Houghton, Lucy Clark and Tasnin Ahed, which was published in December 2025. And at this point, I would like to make a declaration of interest that I did indeed write the foreword to the report. I'm grateful to be given that opportunity. I thought I'll put that on record. So the research report came to the attention of the committee during its inquiry into the British Sign Language Scotland Act 2015 BSL Act in early 2025. I therefore refer members to papers 1 and 2 and welcome to the meeting 3 authors of the report: Professor Jemina Napier from Heriot-Watt University, Dr Claire Houghton from the University of Edinburgh and Lucy Clark from LCC Scotland. You're all very welcome this morning. Thank you so much for joining us. We have scheduled up to an hour and a half for this discussion. We have not scheduled any breaks, but please indicate to me or the clerk if a break would be helpful for anyone. Before we do move on to questions, I would like to invite you all to make an opening statement, starting with Jemina.
Using in sign language because I want to respect Lucy as the deaf author and also the deaf women involved in our study. So thank you so much for the opportunity to come back after the inquiry. We received information, or you've already received the information about the report, so I just thought that we will pick out some highlights from the report. So the Sign Loud report were in-depth interviews with deaf mothers and BSL users, and then also practitioners who support deaf mothers who are victim survivors of domestic abuse. So we've worked with people who have experience in the so-called BSL world and then also the gender-based violence world. So we created recommendations from the evidence that we've collected so far. So we just want to give you a few highlights. So over to you, Lucy.
So in our research focusing on deaf parents, what we found is that their experience of emotional and physical abuse was compounded by the fact that they couldn't get access to support in BSL, placing them at greater risk and danger. And so if we think about the lack of access, how that impacts their ability to recover or gain support. What we also found that there was an observable difference between the experiences of hearing victim survivors and deaf victim survivors, because the way that the lack of access is available places them at greater risk and vulnerability. Professionals do not always understand the kind of dynamics, the cultural background. They're not able to make the adjustments or the appropriate response or put in place appropriate support in place for these mothers.
So, just to continue on that thread, essentially what we know is that the deaf women told us they were experiencing effectively a double trauma. So because they have a lack of access to information in BSL, a lack of opportunity to talk about their experiences of domestic abuse in BSL. So the key findings of our report, which were highlighted in the inquiry report as well, is that they need more access to information. The Delivering Equally Safe Fund is currently already funding Deaf Links in Dundee to work in collaboration with several branches of Women's Aid. And Lucy's actually been doing some work for them to develop some training and to provide a deaf-specific advocacy service. But that's only been considered as a pilot so far. It's a temporary provision which has currently been extended, but we don't know the future of that work. So I think what we wanted to emphasise is that deaf women told us they felt that they're doubly disadvantaged because it's hard enough to talk about domestic abuse anyway for anyone. But when you're a deaf woman who can't access specific services, can't access information, doesn't feel like you have access to support in British Sign Language, they really emphasise the need for these kinds of deaf-specific services like we're seeing in Dundee and Tayside, so that has both the BSL expertise and the domestic abuse expertise, because quite often the generic services don't understand what deaf women need as BSL users. We want to really recommend that the scaling up of pilots like we've seen in Dundee, so that we can provide more consistent advice and advocacy for deaf women across Scotland. We also need to improve the opportunities for people working in the universal services to upskill and understand how to work with deaf women, because we understand if you're in a rural area, for example, it's less likely you're going to be able to access a deaf-specific service. So if you need to access a local service, do the people working in that mainstream or universal service understand what the needs of deaf women are, or at least how to get the support that they need to provide that support to deaf women. And one of the final point I'll make before handing over to Claire is about the lack of provision of BSL interpreters. The deaf mothers that we interviewed all told us that they feel really vulnerable in reporting because they're not sure if interpreters will be booked. Sometimes there are long delays in waiting for interpreters, and that can heighten the trauma that they're already experiencing. It's hard enough to kind of pluck up the courage to go and report in the first place, and then to be sitting around waiting for an interpreter can actually exacerbate their feelings of vulnerability. They did acknowledge that there might be opportunities to use video interpreting in emergency situations. So, for example, when they're initially reporting a trauma, but that any ongoing support should really be through face-to-face interpreting, and that there should be the opportunity to select interpreters that they're familiar with because they're already feeling vulnerable, and to think about the gender of the interpreter as well that's sent to work with them. So this is all really just a small part of the justice journey that they experience, and it's not only with respect to their contact with the police, but and we know that Police Scotland actually are doing a lot of work in that space, and we worked collaboratively with them on a lot of different projects. But we need to think about the broader universal sort of domestic abuse services and how they're providing that ongoing support to deaf women after they've come into contact with the police and reported any incidents. And I'll hand over to Claire.
Thank you. So I just wanted to say a little of what deaf mothers told us about being mothers. They were particularly worried about the unique impact of domestic abuse on their children, which we kind of felt was a hidden finding, and that was true of deaf children and children of deaf adults, CODA, so-called. So our research uncovered a kind of heartbreaking dynamic in deaf households, where hearing children of deaf mothers often hear the abuse coming, whereas their mothers maybe not. For example, doors shutting, glasses smashing, etc., threats shouted. And they are living in a kind of auditory world of trauma that their mother cannot access. Conversely, deaf children are hypersensitive to visual threats and body language, what we were hearing that as mainstream support workers didn't have the training to communicate with the mothers or with the children or understand specific sensory triggers. Furthermore, perpetrators of domestic abuse unfortunately use unique tactics to exploit that and exploit their command of English if they're hearing perpetrators. Which meant that deaf women felt invisible at key moments in their children's lives due to communication barriers and bias. Deaf women particularly fear the statutory response. We know that hearing victim survivors also fear that response, but it was acutely felt by deaf mothers. That was partly because of fear of bias about whether they're good enough, seen as good enough mothers already, so a kind of stigma about being deaf. But historical abuse in the deaf community by statutory agencies in Scotland, and fear of child removal, which had happened to at least one of the mothers and others that we heard about from the workers. But we felt we really heard about deaf women and how strong they were, but we felt the system stripping away their agency by failing to provide communication support. So this is acutely felt with one of our main findings, which was the child being used as an interpreter or a child language broker. And we feel it's fundamentally unacceptable, as did the women involved, that hearing children are still being asked to interpret for their mothers. And we heard this with every agency, but particularly in terms of police call-outs, but also welfare checks or court welfare proceedings. So people actually coming to the home and speaking to the child and not the mother, as we heard when the mothers met the DFM. One talked about how she was in the kitchen whilst the child was speaking to the social worker in the living room. So women feel that they are not able to protect or support or care for their child, but furthermore, they're not even informed about what's going on. So the child is therefore missing that support. So it also obviously forces the child to vocalise the abuse they are witnessing and experiencing in the family. It can reverse the parenting role, but these women were very strong parents and adds immense emotional strain on both. But the mothers felt that they couldn't be a strong protector if they have to rely on a traumatised child to speak for them. So one of the recommendations, which we can talk about with you, is we need a guarantee that professional interpreters must be standard for these families, and a child should never be the voice of the family's crisis and trauma. And lastly, in terms of mothers and children, we heard, and this resonates with your excellent work on the BSL Act, the importance of BSL from an early age for both deaf children, but obviously for coders, which I, as a hearing person, wasn't aware of, the fact that mothers and children couldn't actually communicate, and communicating about domestic abuse. It's really difficult anyway, having worked with children for 30 years. It's really difficult for mothers and children to communicate. Now imagine if that child isn't eloquent in BSL. But we did find that where there was a shared language, that it really strengthens mothers-child bonds, really centres a sense of safety and connection, and that we need to really improve. There's a lack of deaf-specific resources and programmes on communicating with children. We have some really good pilots in Scotland for hearing mothers and children, group work programmes and one-to-one, and we need to be able to supply that to deaf families and help them to improve their communication. And over to Lucy to finish for us.
Thank you. So I really appreciate what the Deputy First Minister mentioned, how she was inspired by our recommendations at the round table, and thank you to Karen Adams for hosting this in December. But we do need more action. We need national action so that all deaf women and their children can access specialist support. We also need funding for specialist workers who understand deaf culture and domestic abuse. We need to help mothers and children rebuild their lives together using a shared language. Thank you.
Thank you all very much. We're now going to move on to questions, and I'm going to start us off. Jemina, because you touched on this in your opening statement, given the shortage of interpreters, what specific approaches would most effectively improve access to qualified BSL interpreters in domestic abuse and justice settings?
That's an excellent question, and I think this is a question that we've been battling with in some senses for some time around access to public services in general. And then when we look at domestic abuse situations, obviously it becomes even more specific because of the extra vulnerabilities that people are experiencing. So people often talk about the need to increase the number of interpreters, which, because we know in Scotland at the moment there are only approximately 60 qualified interpreters throughout the country. The majority of them are based in the Central Belt, so between Edinburgh, Glasgow, sort of Perth is just about covered, but in those sort of more regional rural areas and down in the borders, further north you go, the further south you go, there are hardly any interpreters available at all. So one of the priorities would be not only training more interpreters and increasing the number so we can increase the demand, meet the demand, but actually ensuring that interpreters are available to spread throughout, geographically throughout the country. And alongside that, I know that Police Scotland, for example, have been looking at developing their own in-house video remote interpreting service, which we think would actually go a long way, and at least initially, for that kind of contact for domestic abuse specifically, but any police contact where actually we've had some research that's been done previously about that first point of contact by Robert Skinner, who's actually one of our interpreters in the room, that showed that if you can offer video interpreting for that initial contact, it actually would help to reduce a lot of stress and trauma and feelings of vulnerability, because then people understand what's happening. Like Claire said, not knowing what's happening can actually then exacerbate feelings of trauma. Well, if you know that there is an interpreter that's been booked and is on the way, we're having to wait, a period of time, but at least if you've got some initial contact through video, it can actually go a long way to sort of alleviating initial stress or distress, and then to have a face-to-face interpreter come along. One of the other key things is actually not just increasing the number of interpreters, but in Scotland, we actually have a dearth of male interpreters as well, which is fine if you're working, with men in medical situations. We need to improve that context, but we have to think about what's appropriate for which interpreter gets sent where and what kind of booking service is available, so that deaf women can actually express preference about the kind of interpreter they would like to come when they're experiencing a distressing situation like a domestic abuse call.
Thank you for that. Excuse me. On that point of the lack of interpreters, and I recognise that you might not have this information to hand, but is that due to dense population in the Central Belt, or is it due to access to the education?
It's actually a bit of both.
Okay.
So yes, obviously we do know that there are more deaf people that live in the Central Belt than other parts of Scotland, but also because of at Heriot-Watt University we have a 4-year undergraduate programme. There's also other BSL training that happens, interpreter training that happens in Lanarkshire, and so it means that what typically happens is that students will go through the programmes and then will stay in the area where they've been trained. Some do relocate, and we have suggested in the past that there could be some incentives offered. I know in Australia they do this, where they offer the opportunity for doctors. They have to go and work in rural areas for a minimum of 2 to 3 years before they can relocate to cities, so it's a kind of incentive scheme if you're going to perhaps provide funding to support interpreter training, and say, but on the condition of receiving funding, you would have to go and live in a certain area to make sure, and then there's a rotation then that happens to make sure that the rural areas are covered.
Mm-hmm. Okay, thank you. We're now going to move on to questions from Maggie Chapman.
Thanks very much, Convener, and good morning to the panel. Thank you for being with us this morning. I just want to pick up on a couple of points. Jemima, again, in your opening remarks, you talked about the pilot in Dundee, the DeafLinks pilot. Because we know, and your report is very clear, the lack of deaf-specific services is a barrier. You identify that as a barrier to safety and support. What would a deaf-led domestic abuse service look like? Is the DeafLinks pilot it? Or is it the start of what the service should look like?
Again, that's a very good question. Thank you. And I'll start, but I'd like to hand over to Lucy, who's had a lot more involvement with the service. And just to say that I think that definitely the DeafLinks and Women's Aid pilot is definitely what it does look like, because they have brought in signing practitioners. So they have had 3 qualified IDAs, independent domestic abuse advisors, all of whom can sign. The ideal, actually, the next step would actually to have deaf qualified IDAs themselves, because one of the things that the deaf mothers told us was that they actually feel being able to talk to somebody who they can relate to, not just as someone who perhaps has experienced domestic abuse, but someone who's deaf themselves, and so they understand the kind of barriers, they understand the sort of the general issues. So having someone who can sign is definitely the first step. But if you can, we actually would like to see more qualified deaf people trained to be qualified to work. But that model that they have got means that they're providing direct advocacy from people who understand what deaf people need, they understand deaf cultural norms, they understand the way information is expressed in British Sign Language, where the resources are lacking, where to find them, and also things like even how to book interpreters. Something as simple as that, and also advocating for that deaf woman's rights when they are coming into contact with other services like police, healthcare, social work and so on. But maybe Lucy can expand a little bit more.
What we have to bear in mind is that many deaf mothers come from a variety of backgrounds. So you may have from grassroots deaf families, some from hearing families that where there isn't sign language available in the family, or from different religious backgrounds. And so this means that I suppose It's that same experience where if you're a French speaker and you meet another French speaker, you can relate to each other, you can understand each other. But with deaf people, their experience of public services or receiving support from someone that's hearing that doesn't sign, they often feel let down or misunderstood. And so there's that kind of past experience that taints how their faith or trust in services. So if they meet someone who sympathises and understands their background, there's more faith and confidence in the system that they'll get the support that they need. But often, so if we, especially with deaf links, they don't have to explain themselves so much or explain what it is that they need. They can get support from someone who can fill in the gaps or anticipate where the issues are likely to be and proactively respond to them, giving deaf women the confidence.
Thank you, Lucy. You talk there about maybe a victim survivor being reticent to trust or rely on a service because of past experience, and the value that having people who understand deaf culture as being those advocates. I suppose there's a question around how we make sure that enough people have the skills, the language capabilities in BSL, but also that sense of either direct experience, as Jemima was talking about, of being victim survivors themselves, or an awareness of that. That's going to be very variable across different parts of the country. In your view, how do we ensure that people don't get a lesser service because they are remote? So, you know, the DeafLinks pilot is great, but I can see that it might be quite difficult to replicate in very remote areas.
It's about increasing BSL resources.
Okay.
I think it would be beneficial to make sure that each service receives deaf awareness training, some introduction to deaf culture, become more familiar with the deaf community, and work collaboratively with deaf services in their area, just to make sure that they're in some way prepared or informed on the needs of deaf people. I just think services need to open up their eyes, because the information is there, it's waiting for them.
Yeah.
And it's just a matter of taking that step forward and learning how to connect with the deaf community. It's taking a proactive approach. No one is training them on how to work with deaf people, so they need to take that first step, reach out to organisations. We've got Deaf Action, we've got the Scottish Ethnic Minorities Deaf Charity based in Glasgow, SEMDEC. So there are services and organisations out there that's ready to offer their knowledge and support. It's just a matter of reaching out to them and working with them. What I notice is that these services learn a lot about the different types of disabilities, but they forget that they need to learn about deaf people's needs. And I think that can be used as the basis to tackle some of the systemic issues.
Thank you. That's really helpful. And I, as somebody who worked in the Rape Crisis Network before this, we never talked about BSL or deaf culture. So I think that point you make is very important for us to take on board. My next question, Claire, if I can come to you. You talked about children acting as language brokers.
Yes.
And I'm interested in how we can... I mean, you talk about having the right interpreters in the right place. Is that not all we need, because that's a big ask, but is that the main thing we need to ensure that children are never put in that position? Because it's not fair. It changes, it distorts that relation, that parent-child relationship. It's traumatizing, all of that.
It's an important part of this, the right, but I think it's just one part, really, because mothers were saying they'd received very little support in relation to them supporting their children. So in terms of domestic abuse and hopefully moving away from domestic abuse, or someone, the agencies working to tackle the perpetrator. But they were really focused on their children, supporting their children, and how the communication, we know in hearing families and your previous work, that the perpetrators can actively seek to kind of separate the mothers and child, make sure they can't communicate about the abuse, make sure the child is silent so doesn't reach out for support, as well as the mother. And that dynamic is even further complicated by who can speak English and who's using BSL in the family. So we really felt there was a lack that deaf women as mothers felt it was really difficult to access services for support, and partly that's down to what Lucy talked about in terms of the trust of agencies and the fear that if they talk about and disclose abuse, that their child would be taken away, especially if the perpetrator's hearing and confident and eloquent and able to kind of manipulate the services, and so that often kind of traps them further in this kind of double trauma of domestic abuse and not being able to access support. But mothers and the practitioners were talking about how programs such as like Children Experiencing Domestic Abuse Recovery, CEDA program, or there's a Freedom program, they've started to pilot groups of deaf mothers and mixed groups, interestingly, deaf and hearing mothers, to support women to be able to talk to their children about abuse. But the children also need support to be able to talk about their experiences of domestic abuse. I mean, we've made great strides in Scotland. That's been my lifetime's work, is to get specialist support for children. But there's very little specialist support, especially for deaf children, but also for coders, so we understand the experiences of children of deaf adults. So I think we've got a lot of work to do, but also these children were acting really strongly and caring for their families and protecting their families. So we don't want to just talk about, as one of the young people I worked with said, poor wee victims. These are really active, agentic children that are doing their best in a difficult situation. So they need support as people, and sometimes mothers and children felt it was okay for some language brokering, but that was not in a domestic abuse crisis situation. And not in terms of the justice system, back to Karen's point, and not in terms of statutory services. So, yeah, I think we need to look at provision for deaf victim survivors and their whole family, and make sure children are at the centre of that. So, yeah, there's a lot to do in terms of mothers and children, but some of that is BSL, capabilities of the children as well as all of us.
Yeah. No, thank you. And I mean, one of your points there, I think we'll I think reflect as a committee how to what we can do about this is families, whether it's the mother or the child, not trusting somebody else to say because they're worried the child might be taken away, or you know, that stigma around being a bad parent.
Absolutely.
How we deal with that in terms of providing that whole family support that's required. I think that's something we'll have to tease out a little bit more.
Absolutely.
Thank you. Thanks, Karen.
Thank you. Can I? Oh, Lucy would like to come in. Yeah.
We also have to really carefully think about the next generation. We need to include BSL in education right from the start so that everyone learns BSL. And that would help so much for the next generations from language deprivation point of view, because I'm from a hearing family. My family doesn't sign. So it's been really difficult for me to open up to my family because they don't understand my culture, my deaf culture, my deaf relationships. And I don't know what's right or wrong then anymore. And that affects deaf mothers as well. If they go to supervised court arrangements where fathers and children can meet, and court staff will monitor how the family will interact with each other. So the father might continue to abuse the children, and then the mother might want to interfere. So there might be emotional abuse part of that as well. So there need to be interpreters provided for those situations as well, so that the mothers know what's going on to protect the mothers and the children.
Thank you. Thank you for that, Lucy. I was going to say, I think some of the most disturbing evidence that you had been presenting was the fact that some children are being used as interpreters, and when the police arrive on the scene, children are having to talk between their mother and the police and describe what has just happened in a very traumatic incident. Children as young as 6 or 7 having to do that, and I think that's something we really do need to reflect on as a committee. It's just outrageous that that's happening.
I couldn't agree more.
Thank you. We're now going to move on to questions from Paul McLennan, please.
Thank you, Convener, and thank you, Lucy. The lack of understanding of rights and consent is a risk factor for deaf women, and you've touched around about early education and awareness raising, which I think is really important, and it's for adults in terms of who need to understand knowledge and understanding for deaf women and children. I just wonder if you can say a little bit more around about that, because I think that's a really important point that you've raised.
Sorry, a bit more about...
Just around about early education and awareness raising. Particularly around about the consent issue, and I think, because I think that's really important.
I was surprised when I went to a workshop with Definite in Dundee. All the women there were over 50. They were retired, and they were the victims. They had deaf children, coder children. Sorry, I'm going off track here. So it's about consent. So I was offering a workshop to them about the topic of consent. None of them knew what consent meant. None of them could talk about what their rights were. So they didn't have the basic understanding. They didn't have access to information about women's rights, rights to the home, rights to possessions like the car. And they were talking about how, in their time when they were younger, technology wasn't around, and they weren't aware about consent, age for having sex, and so they were talking about their experiences and the difficulties that they had. And one of the issues is that because of the way that we communicate in a visual way, there was concerns about how they express themselves. So sign language can sometimes seem very direct. So when I spoke to deaf women about their experiences of abuse and issues around consent, not all of them were able to talk with confidence about consent. And so what that says to me is that there wasn't systems in place to ensure that deaf women felt confident to know their rights, to ensure that nothing was done without their consent first.
Thanks, Lucy. Just because I think there's a few things, I think, for me. What, in your view, is the best way to tackle that? Is it through schools and education at an early stage for women? Is it through, for example, Deaf Action? What's the best way to make sure that that doesn't happen in the future?
It goes back to the point that we made before, that we need more deaf IDAs, deaf trainers, deaf women, leading these workshops, talking to deaf women about their rights, consent. So, for example, just general sexual health things, periods, hormones, understanding rights over your own body. So you get access to so much information just from listening to conversations on the radio. If you think about the news programmes talking about women's rights and women's sexual health and so on, we don't have access to all of that information in the mainstream. So part of my job working at LCC Scotland is to address that gap, to offer workshop to women to make sure that they understand their rights, making explicit to them what's available around to most people in society, and so that they understand who to ask, where to go for support, and help them find confidence so that they can ensure that their rights are respected, such as the basic thing is getting access to an interpreter. Many deaf women think that it's their responsibility to book an interpreter, and they don't want that responsibility. It's an added burden. And so it's making them aware that they don't have to take on that responsibility. That responsibility lies with public services. So it's ensuring that there are people out there working with deaf women who have the right knowledge to ensure that they can support deaf women who are in those positions.
Thanks. I was going to say if Claire or Jemima wanted to come in on that point.
Just wanted to pick up your point about children. I mean, we need more Lucy's in terms of the social media and the deaf community workshops that she does with the deaf community. But in terms of younger children and children at school, we're concerned that deaf children especially, but also children of deaf adults, are accessing information about being equally safe at school. We've got a lot of work going on in the equally safe gender-based violence arena. So in terms of healthy relationships, safety, who to go to ask for support, and we need to make sure that that the children are getting both the kind of domestic abuse, gender-based violence work, but also the deaf awareness and the BSL, the information in BSL and access to BSL. So we're not convinced as yet, and we've asked the government, are we sure that we are going to the places where deaf children are being educated? Are we sure that we are making sure that those without a language, the English language can access BSL information? Because we're not convinced that that's happening, and they're even less likely to be able to speak out and speak up. But we know when children do that things can change really quickly for the whole family. So I think we've got a lot to do in terms of all children, in terms of BSL, domestic abuse, and being able to speak out about abuse. So I think that early intervention is crucial.
If I could just reiterate what Claire was just saying, I think one of the key things I think you highlighted in the report with the BSL inquiry as well was the language sorry, I can't even say the word, deprivation that we know happens. So we do need to go right back as early as possible if BSL provision is embedded in schools for early years for deaf children, but also in the support of families, then often what we know will happen is that some of the barriers that are experienced later in life will actually be sort of prevented, because there'll be a lot more access. So not only giving BSL acquisition and information as early and education as early as possible, but this raises awareness in the wider community. If more people are learning BSL and deaf awareness in the mainstream, so we'll actually see a lot of those barriers will come down. So I think the earlier we can start, actually, the better.
Thanks, Pam. Thanks, Camina.
Okay, thank you. Just on that point then, can I ask, because I do understand that if there are things that are often taboo to talk about, like sexual health, women's hormones, sexual consent, but coercive control is also something quite hard to describe in the hearing world as it is. So do you think that these things, when we know that these discussions that are often hard to have in the public space, that we should be more cognisant, particularly within public services, that there needs to be a more active reach out to the deaf communities, that the materials have to be in BSL, for example? Claire?
I undertook the research with hearing women on the implementation of the Domestic Abuse Scotland Act, and they were saying that it was really difficult for them to talk to agencies about the manipulation, the coercive control, the surveillance, all of the things that are really well defined, I think, in our Act. But they didn't realise the Act was about children. So that's a major step forward. And I think deaf victim survivors don't know that that Act exists, many of them, except for if they've been to some of the workshops. I think that Act is a really good kind of motivation, inspiration, and a law that would actually really outline psychological violence. But I think victim survivors, the general public, are not aware of all the provisions of the Act, nor that it includes children. So if we imagine the general public or not, and these hearing women were from all different types of educational backgrounds and in services and things, they felt there wasn't enough awareness. Then I don't think deaf victim survivors are going to be aware. And the other step forward with that Act is talking about ongoing abuse. And these deaf victim survivors in our study had experienced ongoing abuse for years and multiple forms of abuse, including as children. So we need to really get the awareness of that Act to everybody, including children and deaf victim survivors. But it is the most difficult thing to talk about. How do you talk about being manipulated, coerced, controlled? Now, if that coercion and control is actually by somebody who's using the English language and is seen as more of a good enough parent, bizarrely, to agencies, then that accentuates the kind of control that those families experience. But I do think it is an opportunity. I think even the very visual domestic abuse Scotland advert could be useful, but we're not seeing enough of that public awareness a few years on. So I think we need to revisit that Act.
Thank you. It's very helpful. Yes.
Just to say, go back to your point about sort of the taboo nature of many of these topics. And Lucy and I had worked on a project before the Sign Loud project with Claire, where we were called the Silent Harm Project, and we actually brought together a team of people who had expertise of working, there's some IDVAs, independent domestic violence advisors in England, who are deaf. So we brought them together with interpreters who had worked in domestic abuse situations, deaf translators, to actually create a glossary of signs in BSL for key sort of terms like coercive control, like psychological abuse, trauma. So we felt like we've only scratched the surface, but we felt it was a first step to trying to open up some of the discussion in the deaf community by saying, here's some vocabulary to talk about it. This is what people who know this topic and have worked in this area, this is how they talk about it, but trying to make it a bit more public. So we've created this glossary, we created training materials, which Lucy has then gone on to use a lot more with the training that she's been doing with DeafLinks and with other organisations. A lot of people now reach out to her for training because we're trying to promote this idea of it's okay to talk about it, and these are some ways that you can talk about it in a way that's understood. And these signs were created by deaf people for deaf people, so they've come from the community, and I think that's part of the journey as well, is us developing the discourse, developing the language around how to talk about it in BSL.
Yeah, that's really interesting, Jemina, because if you don't have the language, how do you communicate it? Yeah. That's a really pertinent point. Thank you for that. We're now going to... Oh, Lucy would like to come in.
Yeah, like Jemina was mentioning, in the Silent Harm project, we gave a lot of examples in videos as well. So we know that some people don't feel comfortable watching those examples. And I'm not hearing, so I don't know how that must feel, but people were listening to it and they made those connections and recognitions of what that felt. But the video examples for deaf people, they were like, oh, I went through that example and I had that experience, but they didn't know that it was labelled as domestic abuse, for example. So we had to share our experiences, and all those examples had to be shared with the community, and deaf women would then go, oh, I've experienced that. And then we could kind of recognise and decipher all the stories of all these people and what people are talking about. So we talked about those topics because it's like, yes, deaf women are vulnerable, but when we're talking about these topics, they're very open, they have demands, they're craving that kind of information. So once you start the conversation, it will continue to flow, and they don't know how to share this with their hearing families. And I'm very lucky because I'm very forceful. I speak out and I make sure that deaf women are looking at their rights. And I'm deaf myself. So I can give visual examples. And that's what I did in the Silent Harm film as well. And we need more of that kind of visual information to kind of get those examples being spoken about in the community.
Great. Thank you so much, Lucy. We're now going to move on to questions from Pam Gossel, please.
Thank you, Convener, and good morning, panel, and thank you for the information you've provided so far. In your report, you have recommended the establishment of an equally safe BSL advisory group and described this as critical. Could you explain further why this is critical and if the group must be established for the other recommendations to be taken forward?
Hello, Pam. Thank you for the question. Well, we knew that the equally safe gender-based violence plans are due for a refresh this year after the elections, all being well, and we felt that deaf victim survivors and deaf agencies hadn't been involved in the equally safe development over many years. And it was time that they had a voice. There have been steps forward in terms of black minority ethnic women and women with learning disabilities, but less in terms of deaf victim survivors and in terms of children, both deaf children and coders, but also children more generally. So we thought that was a kind of pragmatic step. We had this stakeholder workshop, which included the government, deaf organisations and gender-based violence organisations, and we felt that that workshop brought together such skills and a real sense of allies in improving the services, and if that kind of set of people could be a part of the governance of Scotland's main plan in terms of gender-based violence, then that could make a real difference. And we felt that deaf victim survivors and their children should be part of what we would call action projects or action research projects to develop the services that we talk about in the report. So we thought that was a possible, a pragmatic step, a critical first step. Obviously, the deaf-led survivor services, along with the more geographically covering BSL and signing services, was, the most critical step. But we thought this was a step forward, and that was the most obvious governance type framework. Though we've also been talking to the BSL government leads, and we are waiting to hear about going to the national plan meetings about the services. We haven't heard from them as yet. So yeah, that's what we thought. We're open to other suggestions to get this moving as well.
If I could just add to that, I think one of the key reasons behind that suggestion as well was actually to bring the experts together in the room together, and I think that's where we've seen the gaps occur, is deaf women saying, well, if I go to a domestic abuse service, they don't have the BSL expertise. If I go to a BSL service, as we know, Deaf Links, prior to being funded for their specific project, had a lot of experience of working with the deaf community, but hadn't been funded to work specifically on domestic abuse. So there are gaps there, and so by bringing together the experts, whether it's an advisory group or some capacity, so they're actually working together, then we think that we're certain that we're much more likely to get more traction and actually see outcomes which do benefit deaf women and all, and families in this space.
Thank you for those responses. Statistics released last week have shown that sexual crimes, rape, attempted rape, as well as domestic abuse have been on the rise. At the same time, Women's Aid, rape crisis centres across the country have reached a breaking point due to an influx of cases coupled with inadequate funding from the Scottish Government. As you have said today and during the previous committee sessions, we've heard deaf women face barriers that hearing women do not necessarily face. So do you believe the Scottish Government is failing deaf women? Professor Jimna, I want to go to you first because you'd mentioned earlier on in the beginning to say that all services should be upskilled and they should all be providing these expert services. So it's a little bit worrying if obviously the current services are under so much pressure and they don't have adequate funding. So I wanted to hear from yourself first to see if you have any concerns on this.
Thank you for that question. Yes, I mean, I understand that resources are stretched and it's not possible to provide 100% of service for everybody 100% of the time. So priorities have to be made. I think my point earlier about upskilling mainstream or universal services is so they understand where to refer to. So given that the deaf population is concentrated around the central belt, we would have concern about women living in rural areas, for example, but we know that it wouldn't be feasible to have deaf-specific services in every region throughout Scotland. But if there were several deaf-specific services established in key areas, especially where there were increased populations of deaf people, and then there was training and resource and awareness raising done within mainstream services, and so that they understand, okay, what to do when a deaf woman first presents, how to at least have some initial interaction with them, but then also where to signpost them to, that they wouldn't necessarily have the expertise themselves, but they know where to go to get it. And I think that's one of the gaps that we're seeing at the moment, is from what the deaf mothers told us and what deaf women have told us in our previous projects, is that they go to services and the domestic abuse, their local domestic abuse service has no clue what to do. They don't know that they're even entitled to book interpreters, where to get the interpreters, who pays for the interpreters, how to support the deaf women. And so if we're going to be realistic, yes, I think we are failing deaf women in lots of ways, but I think there are quite tangible solutions that could be put in place that would support the community throughout Scotland if we're clever by through networking, the different services that are available, by having specialist provision, expert provision available, which then those other mainstream services could draw on or could partner with to make sure that the deaf women get what they need and their families get the support that they need. To go back to Claire's point earlier about providing that sort of holistic care across all of the services for all people who are experiencing domestic abuse. And we haven't covered it specifically in our project, but we are aware that there is also a lack of research or understanding about the needs of deaf perpetrators. So they probably experience very similar issues. Do they even understand what consent means? Do they understand, not excusing the behaviours by any means at all, but making sure that there's also support mechanisms for deaf men as perpetrators to understand what's not appropriate and therefore to look at the whole picture.
Come in there as well. Yeah, I agree with that in terms of our perpetrator programmes and access for deaf perpetrators to those programmes, I presume, is really limited. I've not heard of deaf perpetrators being on those education programmes. But just to go back to your original point, Pam, I do think that the government's letting down deaf victim survivors in terms of funding, but also as Maggie Chapman has also raised, that there's an issue about sustainable funding for our domestic abuse specialist services, and it's women's aid and rape crisis being key gender-based violence services, but also we have an assist service coming back to the criminal justice system, which is the Scotland's IDA's Independent Domestic Abuse Advisors, and Assist covers half of Scotland, mainly the West and Dundee, but there aren't IDAs in most areas of Scotland still. Furthermore, I was concerned to hear that they are now limiting the victim survivors that are eligible for their service due to the increased demand recently. So they're only going to be those that the police deem to be at higher significant risk. I think that's a really concerning turn of events, because every single woman who comes to the police will have experienced abuse for a long time. We know that. So every single of those, woman and the child involved should be able to immediately access IDA's domestic abuse support services, and that's not happening just now. And deaf victim survivors will have increased barriers. And Lucy and Jemina gave evidence to the Violence Against Women and Girls review of the strategic review, the independent review of the funding and commission of Violence Against Women and Girls services, and that recommended sustainable funding for all of these services over time. If they don't get sustainable funding, then they can't develop to meet the needs of so-called minoritised groups. They can't develop because they're going from one funding crisis to another. The demand is so high that we can't expect them to innovate in terms of the deaf victim survivors, but also in terms of children, in terms of other minority groups. And the review recommended by and for services. And we need to, yes, establish what that means, this deaf-led service in Scotland, as well as the more peripatetic BSL sign-in support. But we're not in that kind of context at the moment because it'd be difficult for those services to even get around the table. So I agree with your premise, your point. Thank you.
Thank you. I just got a couple more questions. What do you consider to be the most pressing gaps in data that must be addressed to properly understand the domestic abuse experienced by deaf women, particularly given that you have previously said that deaf women are often grouped within a wider disability categories? Opening that up to anybody.
This is Lucy here. So a lot of deaf people, there are different ways, there are different perspectives and approaches to how deaf people can be labelled or classified. So some define themselves as belonging to a linguistic minority community, some define themselves as belonging to a disability community, so some may define ourselves as deaf disabled. But I identify as a BSL user, not someone that's... I just see myself as someone that's just happened to be born that can't hear, but come from a different linguistic community. There's often misconceptions around deafness, that they've got learning difficulties or so on, that BSL is not a fully fledged language. And I just think people just need to be more tolerant, patient, and not too quick to kind of label someone in a particular category, but just take a bit of time to understand how the individual would define themselves. And in terms of recording or collecting data, it would be nice to be able to be identified in more than one category. And then that will help us understand where resources are needed or where there's a demand for types of resources in certain areas.
If I could just add to that, just allowing for the slight delay with the interpretation, so wanting to wait till the interpreter was finished before coming in. Yeah, absolutely. As Lucy said, deaf people are often lumped together under disability statistics, and one of the critical things for us would be to be able to identify who deaf BSL users are. We know that there are many people in Scotland who would identify as having a hearing loss, but don't necessarily use BSL, so they might tick the yes, I am disabled box in a census or any other kind of data collection exercise. But deaf people who use BSL would see their needs as being very different, so would actually want to be able to access services and support, and like Lucy said, identify as part of a linguistic and cultural minority, so their access needs and their support needs will actually be quite different from a wider population of people who might have a hearing loss but don't identify with the deaf community. And at the moment we don't have access to that data at all because, we know that not enough information is collected about, statistically about who experiences domestic abuse anyway, in terms of, and I know, Pam, you've done some work around this yourself, trying to establish, how many, do we actually even know how many people from different ethnic minorities experience abuse as opposed to white Scottish people, and how many disabled people, how many people with learning disabilities and so on. They're very generic numbers at the moment, and it's difficult to pinpoint. We often cite that deaf women are 2 to 3 times more likely to experience abuse than hearing women. And that's a number that we've got from America, where they've done some research over there. But we don't have any kind of equivalent statistic that we're able to cite from here, either in Scotland or the UK.
No, thank you. Professor, just on that before I go to my next question, you're absolutely right. There is a big gap in data. When I was working on my Prevention of Domestic Abuse Scotland bill, there was an area on data, and right now, basically, anybody reporting domestic abuse, whether you have a disability or not, going into the police station or going to the police, it wouldn't be recorded right now that you have a disability. That's not one of the questions that get asked, and it's not been recorded, so they can't obviously produce that data. So it's something that I will still carry on pursuing, but I think there is a big gap there. If we don't know those people coming through the doors that are reporting domestic abuse, if they've got a disability, how can we provide the services and how do we know what the needs are? So absolutely agree with you, Professor, there. My last question, you have answered some of it, but I just want to give you some kind of understanding around, obviously, some other evidence the committee has taken. You know, through the Equalities Committee, we have taken evidence on neurodivergence and on barriers faced by people with learning difficulties, similar to the deaf women, and women with learning disabilities are more likely to have experienced domestic abuse. However, these are two distinct categories. So could you elaborate on how the needs of deaf women differ from those of other disabled women? And I also know you've touched on that, but it's just to give you an understanding. We've already taken, you know, evidence from learning disabilities, and so it'd be good to understand that how it differs.
My initial reaction is, as a deaf person, when you see someone who's hearing that's got learning difficulties, however they've been diagnosed or defined, but the main difference is that they can speak directly to the service. So they just, because they've got a shared language, they can get the attention and support that they need. And so it's a hearing-centric space. So we, as a deaf person, we're not given the opportunity to be heard or to express ourselves, or we can't communicate with you directly. So I think, you know, that's the main difference, is that they can speak.
If I could just add to that, I think Lucy's point, I think, is a very good one, is that there would be lots of parallels. Of course, there'll be parallels in the kind of barriers experienced, accessing support services where people understand what their specific needs are. But I think the critical thing for deaf BSL users is, as Lucy is trying to stress there, really, is that because there are BSL users, and going back to the point about language deprivation earlier, there are many members of the deaf community who don't have high level of English literacy skills, and so you can't assume that even if someone is a competent BSL user, they're a competent English user, and a lot of resources and information available is in English, and sometimes it's created in plain English or is presented in a way that might meet the needs of people who are neurodivergent and have learning disabilities, but doesn't meet the needs of deaf people because it's not available in BSL. And the work that we have done to date, which actually led us to creating some resources, is because we found that there was virtually nothing out there in BSL at all.
Okay. Thank you very much for responsive. Thank you, Convener.
Thank you. I'm just cognisant that we're an hour into this session now. We still have half an hour left to go, so I'm just checking in that we're okay. Does anyone need a comfort break? Do you need to suspend briefly for the next few minutes? We're all good? Yep, we're all good. Okay, that's great, thank you. We will now go on to questions from Marie McNair, please.
Thank you, Convener, and good morning, panel. Lucy, you said in your earlier comments that we need action now. Do you feel there hasn't been enough action from the Scottish Government on your recommendations, and you know, what response have you had back from the Scottish Government? I'd be really interested to hear.
Should we let Claire start? Yeah, I think let Claire start, and that way it gives me time to think of how I'm going to formulate my answer. There's quite a few things I'd like to say, but I just need a moment to think about how to frame it.
Thank you for the question. The Scottish Government, the Violence Against Women and Girls team and the Equality Directorate did come to the stakeholder workshop, and then the DFM with Karen Adams' support obviously met with us and deaf victim survivors. So they've heard the recommendations, got the report. We've been invited to the Equally Safe Joint Strategic Board on Thursday to go through the key considerations with that board. So that's, hopeful. But in terms of actual, and there has been some delivery in Equally Safe funding, diverted towards Deaf Action, and Lucy's been working with them on providing some information resources to deaf victim survivors. So things are moving a little too slowly for us. I'm guessing Lucy will follow up with. And there are still real gaps that need addressed, obviously. So, for example, in terms of providing more support, specialist support workers, including independent domestic abuse advisors who use BSL, we need to, and especially for deaf women to actually be able to be trained in that area, we need a whole different kind of system. Because to actually become a qualified IDA, one has to already be working in a service to do the learning and to actually be able to do that. And yet we don't have a deaf-specific service. So we need to kind of be really creative and start thinking about how we can actually create both a service and also improve the services around us. So we are aware that it's not all immediate and possible, but we need to start making concrete steps now and galvanising the kind of energy that was in the room with us at that workshop, which was, we're going to come up to a year from that already. Our funding has stopped now for the project, but obviously we'll keep pushing on those doors, but we need to be able to fund the stakeholders to get together. It costs. We need to fund Lucy and others' time. Tasnim can't be with us today, but we need to get those experts even getting the experts in the room costs. We're struggling to get that action. But they've been short, small, and some of the allies are getting together, and Police Scotland are working with Jemina and Lucy. But we can't be waiting. I spoke to members of the Violence Against Women and Girls Strategic Review team who are monitoring the lack of progress on that review, including for deaf victim survivors. And one of those did say that this deaf victim survivors was raised years ago in terms of, which we didn't know about. But we can't let it just go off the agenda again. So we're really appealing that we keep it on the Parliament as well as government agenda.
Oh, we agree.
So would Lucy like to come in at this point?
Yeah, so I would like to see more workshops in the social service, domestic abuse service, hospitals, nurses, psychology wards, people who are working specifically with victim survivors of domestic abuse. We need to make sure that they get an introduction, that they know what to do if a deaf person knocks on their door, how they can approach them, and they can monitor the situation and make sure that these service providers are not afraid of deaf people. I think we need more deaf awareness / BSL awareness within the mainstream services, because a lot of deaf mothers have told us that they're so fed up with the question being like, oh, so you can lip read or your family can help us. They feel like they're treated like children. They need to be treated with respect. And I think we need more workshops all over Scotland to address this issue. And then once these kinds of workshops are established, then people know who to contact. They're more confident about who to reach out to that are deaf-specific services. And they will know how to book interpreters because it's their responsibility, not the deaf person's. So I think it's all about being accountable and taking the time to think through how to support these deaf women.
Well, we called for like a national hub of training materials and training the trainers, because there are pockets of good practice, Lee, mainly led by the two women on my right. There are pockets across the country of good practice, and if we could share what we know, because everyone's struggling in terms of resources, and share some of these resources, and also obviously it's got to be part of the training programmes, and universities have got a responsibility there for people like social workers and Police Scotland in terms of their training, and they are looking at that. And my two colleagues have trained Scottish Women's Aid recently as well.
No, thanks for that. We'll certainly take your concerns back to the Scottish Government.
Thank you. Thank you very much. We'll now move on to questions from Rhoda Grant, who's joining us online.
Thank you, Convener. The study involved semi-structured BSL interviews with 6 deaf mothers and a focus group with 5 signing practitioners. How did you ensure that the approach captured the diversity of experiences within the deaf community? And were there any limitations that this had for interpreting the findings?
Yeah, that's a very good question, Rhoda. Thank you for that question. We're always very cognizant of the fact when we're doing this kind of qualitative research that we have quite small samples of interviewees involved. But one of the things that we're able to do when we do this kind of research is that we go deep. You know, we talk to people and we get real insights into their life stories and their lived experiences. But, and maybe Lucy can talk a bit more about this in a moment, but we did make sure that we reached out through our networks by working with Tasnim, unfortunately, who's not here today, who herself is an Asian woman who has experienced domestic abuse herself. She's a victim survivor herself. So both through Lucy and Tasnim's networks and my own networks in the deaf community, but especially networks across different services, different service providers, and reaching out to make sure we wanted to try and make sure that we had some representation across different parts of Scotland and also from different backgrounds. So we did include people who identified as white or from different ethnic minority backgrounds. Also those who maybe had different experiences growing up using BSL as their first language or not, whether they had deaf or hearing family members at home. So we did try and capture a range of different experiences. In the end, we only did have 6 deaf women involved, but we are confident that we did manage to capture a range because they did come from different parts of Scotland and had very different backgrounds and also different experiences to report. And with the signing practitioners, because there are so few signing practitioners throughout the UK, we actually went to and spoke to some people from England as well, because there are only, as I mentioned earlier, 3 qualified IDAs in Scotland who can sign. In England, there are about 5 or 6, most of whom are actually deaf themselves. But we were only actually able to include 1 deaf qualified practitioner. So we basically went to all of the qualified practitioners that we could find, and that kind of led to one of our recommendations that obviously we need a lot more of that expertise. So yes, you could argue in some ways there are limitations around the numbers of people that were involved, but the stories from both the deaf women themselves and the practitioners we could see were resonated with one another, and they all were pointing to the same kind of challenges, the same barriers. So even though we had some diversity in the groups that we had small numbers, but there were very powerful stories that they were sharing with us, I think.
Real privilege to hear those stories and really in-depth interviews down to Lucy's skill in interviewing that we had heard from the deaf mothers. But I just wanted to note the stakeholder workshop as well. Was a mix between those working in kind of the deaf field and the gender-based violence field. So we sense-checked our findings with them. Does this resonate? Is there anything that we're missing? And we've obviously got our page of key considerations. We've got another couple of pages that we want that advisory group to take forward. It was a really good day in terms of sense-checking the findings, that they resonated, but also making sure that we were looking at the different kind of solutions. I think the biggest limitation we felt and the women felt was that we didn't involve children in the study. and we would like to explore children's perspectives, deaf children's and coders, but we didn't have the funds for that. We would have also liked to, yes, maybe more women, but we would have liked to have worked in a longer time frame with even a small number of women to develop some of the recommendations and talk about what their vision for a service would, in fact, answer some of the questions here today. So what would this deaf-specific service ideally look like? How can we reach women and children across Scotland? But yeah, we are aware of the limitations, but also made real efforts in terms of the diversity. I was absolutely shocked at how few deaf and BSL domestic abuse specialist workers were in the whole of the UK, I must say. And even if we'd had all of them involved, it would have been 10, right? Thank you.
How?
Thank you. Rhoda?
Sorry, come back in. So I guess how do we use the learning to better provide services for people? Because you reached out to people, you provided interpreters, you did, I guess, everything you possibly could to encourage people to take part. And that in itself, I guess, kind of points to some of the barriers to people getting help, because if you were reaching out and pulling them in and providing things for them, I still think there are huge barriers out there. So I guess what I'm saying is, how do we take your report and make the changes that kind of break down some of those barriers, because people desperately need the support if they're suffering from domestic abuse?
I think we felt long and hard about the approach and took a really careful approach in terms of supporting women to take part, and I think we can learn from that. So we've all got gender-based violence experience, and 3 members had deaf culture experience and were BSL users. I think, and also that kind of knowledge and insights about domestic abuse, but we were still asking women to talk to a stranger, and they were talking to a stranger for research purposes, and to, well, the main reason they wanted to take part was to improve things for deaf victim survivors. But that's still a big ask. What we prefer is that deaf victim survivors are being offering support first and foremost, and that should and that they would benefit, and that could be long-term and ongoing support. So I think that kind of collaborative approach is a point of learning, and we actually learnt about that approach from Lucy, but also from our work with victim survivors about what's an ethical way of conducting research, and we had a kind of framework for that that we built with young survivors. But I think that kind of collaborative offering we need to make expand for services, and it started, hasn't it, between Women's Aid and Deaf Links, but we need to really improve that on a national scale. We need to be offering very much more than like one-off short-term crisis support, and it probably will take even longer to build up that trust and those trusted relationships with women and children who are deaf, because we already know that that's a big issue for all victim survivors, and the perpetrators doing their damnedest to make sure that they don't access that help. So, you know, I'm hopeful. This is my first time collaborating, and you know, we feel the exclusion of the work so far, as I'm sure, like Maggie Chapman, I've been involved in Women's Aid and other organisations before, being a researcher, and we certainly didn't do anywhere near enough. So if we can all acknowledge that and put the human rights of women and children at the centre here, I think we could really improve. But yeah, I agree that there are obstacles, but it wasn't that difficult. We only had a short amount of time, and everybody rallied round. We had a very short amount of time, very small amount of money. So I think, yeah, we could have had a much larger project. And I was really impressed with the kind of allies that we've made. But these people hadn't been in the same room, whether we're talking about the Scottish government officials, the BSL and Equally Safe, but also the national deaf and gender-based violence organisations, and then the local ones. Except for that one exception, they had not been around the same table.
Thank you.
If I could just emphasise there as well, I think clear things we've learned from this is that we're in it for the long game. That there aren't in the sort of sign language interpreting studies and deaf studies world over the last few years, we've used this analogy a lot of an illusion of inclusion, and how quite often people assume that but by funding interpreting services and putting interpreting in place means that access is achieved or equity or participation is achieved. And more now we're realising that that's not necessarily the case. So it would be easy to say, well, we can fund more training of interpreters, but that's actually not going to alleviate all of the barriers. So, which is why our recommendations are quite wide-ranging, because we think there are lots of different aspects that need to be covered, and we recognise that there aren't quick fix solutions, and that this is a longer-term game where we need to plan and actually be very strategic about what needs to come first, and then things being put in place which will lead to better outcomes for everybody in the long game, in the long run.
Do you have anything else to ask?
No, thank you. Thank you.
Okay, everybody fine? Thank you. We'll now move on to a question from Tess White, please.
Thank you. Hello. So, Professor Napier, you said that we're failing deaf women in so many ways. And Dr. Horton, you talked about the power imbalance of the male perpetrators to domestic abuse. So we've been looking at legal aid and civil legal aid and reform. And one of the proposals from the Scottish Government a couple of weeks ago was to train up 40 legal aid solicitors. Now, that's kicking the can down the road to the next parliamentary term. But I'd just like to hear your thoughts on if that's a start, would it be one of your thoughts to have one of those, at least one, trained up in BSL?
I think it would be useful, it would be beneficial. I mean, it's nice to have someone who can sign. I would say it's better than nothing, as long as they've got the ability to sign, because if they don't have the fluency, it just makes the experience very stressful for the deaf person. But, if you take an inclusive approach, I mean, the whole point of this here is about increasing diversity and inclusion, so that should include language. So if you are promoting these legal services to the public, it would be good to have a set number who are fluent in BSL, that deaf people know that they are available to them if they need them. And I have confidence that once deaf people find out about these legal experts, it won't take long before the entire deaf community learn about them. But the main thing is that they've got high-level fluency and competency in BSL. Once they have fluency and competency, you will quickly gain the trust and confidence in deaf people.
And thank you. Sorry, Professor Napier.
Would it be all right if I just add to that? And I agree with Lucy. I think that in the deaf community, people will often, through word of mouth, say, do you know somebody, whether it's a solicitor or whether it's a plumber or whatever kind of, if someone can sign, then it always does go some way to developing trust and giving direct communication. I think one of the sort of slight caveats would be that if somebody was trained in BSL, if you brought in a hearing person who was trained up to be a legal aid solicitor and you're trying to give them BSL as well, their BSL fluency wouldn't be enough to be able to communicate directly, so they would still need to work with interpreters. One of the creative ways I think that we need to be thinking more about, and I mentioned this I think in the inquiry, was we should also be thinking about training up more deaf people to work in professional roles. It shouldn't always, because quite often we say, well, we'll bring in a hearing expert and give them some BSL. Why not bring in a deaf expert and actually give them the legal training or the medical training, so that it's kind of coming at it from the other perspective? So they're already kind of identifying culturally, and they've already got the fluency, they've got the connection, they've got the trust, and then you're able to equip them with the expertise in the legal domain or whichever domain it is. So that's something that I would like to see more of, is more opportunities for deaf people to train in these areas as well.
That's great. So that's something that, let's say, the Scottish Government can take up with the Law Society as part of legal aid reform and create role models. So thank you for that. My second question, and I was delighted that the Deputy First Minister has taken an interest in this since our inquiry. We had the debate, we had questions in Parliament, but there is a huge disparity between the spend on Gaelic and BSL. And the figures that we've got as 2.5% of the population speak Gaelic and 2.2% of the population can sign language through BSL. But what we're hearing today is if you take domestic abuse and the most...
Spoken language. Sorry, I didn't mean to interrupt. It's because it's a spoken language. I often feel that because you can't communicate with us directly in a signed language, there's little focus or interest in sign language compared to spoken languages. They seem to give direct importance. And it's just this hearing-centric way of thinking that spoken languages are more superior. Just because we can't speak, it's seen as something that's inferior, and it doesn't feel fair from my perspective. But yeah, I just let you finish your question.
No, thank you. So if you've got 2.2% versus 2.5%, you've got 30 plus million pounds a year being spent on Gaelic. Do you have a figure that you would like to say, OK, because you're talking about scrabbling around for money for workshops here and, you know, you've got a couple of people trained. It's great that we've got Lucy and maybe a couple of people. But if you're scrabbling around for let's say, a few £1,000s versus 30 plus million a year, do you have a figure in mind that you'd say, could we just start off with that?
I'd say 60 million. But I mean, I think it's a really good point because I think one of the key differences between Gaelic speakers and BSL users is that BSL users use BSL in their everyday lives. They can't function without BSL. Whereas Gaelic speakers, we know there are less and less people who only speak Gaelic. So the majority of Gaelic speakers are bilingual between English and Gaelic. Even if a deaf person is bilingual between BSL and English, a lot of information is not accessible in English because they can't hear it. So they actually, to function on a daily basis, they need BSL. So the fact that we don't have the kind of funding attributed, and we have a BSL Act, which has been in place for 10 years, which is what the whole inquiry was looking into, and the fact that we don't have dedicated funding, apart from, I think, when the BSL Act was first put in place, there was a small pot of money that was distributed through different organisations, which was managed through the British Deaf Association and what was then Deaf Scotland. But it was a pittance, really, compared to the amount that's been put in place for Gaelic. I mean, there's Alba, the Deaf TV, the Gaelic TV station. They've got their own TV station. They've got specific services. They've got Gaelic medium schools. So if the kind of equivalent funding was put in place for BSL medium schools in particular, and then opportunities for training for deaf people to work in professional services directly, would actually mean there'll be less money needed for interpreting services because deaf people could go direct to deaf services. So we think there should be at least the equivalent amount. If not more.
Thank you. So our thoughts, knowing that the Scottish Government is going to be looking, and this committee will be looking at legal aid reform, that might be a good opportunity to say exactly, Professor Napier, you're right, the thought you had, get somebody who is deaf, trained up to be a solicitor and start the ball rolling. My final question is around, are there any role models, countries that actually lead the way in this, whether, often we hear about Denmark. We've got the example earlier from Professor Napier, actually looking at data, the very fact that in America, that we know that deaf women are 2 or 3 times more likely to experience domestic abuse, but we don't know in Scotland. So what country, if you looked around the world, or are we just feeling our way forwards in this country and we have no role models?
Well, we presented in a European conference And we didn't do an international lit review for this piece of work. We thought we'd go around centre it with deaf victim survivors, but that's an obvious next step to try and look if there's any best practice. But when we presented recently at European conference, it was very much seen as like a new contribution to the domestic abuse field. And it's, certainly in my work, including international reviews, there's very little information. There's some connections between research done with those whose language is minority in the country, and that's the closest we've seen in terms of connecting this work. We're not saying we're the only ones. We haven't done a review, but we've, in the kind of prime conference in the field, there was no one else talking about deaf victim survivors in particular, and there's very few articles that we can see. So we are hopefully breaking ground with very little money, as you say, a 10 grand project. So even, a proportion of that 60 million should change the world in terms of BSL, but a small amount of that in terms of domestic abuse in Scotland could make a huge difference. This national hub, the training of people, CPD, and training deaf professionals. And I don't think it's so difficult to provide a deaf service, at least in a couple of these key places, and this kind of peripatetic support across Scotland. I don't think it would be multi-millions, but it would make a massive inroad in terms of supporting deaf victim survivors. Some of these things that Lucy's doing are on very little money in her consultancy, are really changing women's lives.
Thank you. And can it just in terms of legal aid reform and access to justice, the Citizens Advice Bureau, that's something that's national. I know they're struggling for funding too, but are they able to help provide, for example, at the moment, a woman fleeing domestic abuse can't get legal aid because of the financial... You're not just talking about coercive control, you're talking about financial extension of financial abuse. So the woman can't get legal aid. So is there something that you've thought of to look at with the Citizens Advice Bureau to get some CAB advisors trained up? Or is that, if you had more money, you could look at that? So if you didn't just have a pittance, you actually had some money that you could work with CAB, work with the Law Society. So, Professor Napier, you're nodding your head.
In one of our earlier projects, the Justice Science 2 project was actually the very first one where we started to explore domestic abuse, and Lucy and I started working together. We actually had a meeting with Scottish Legal Aid Board about access to justice for deaf people and kind of across the board. And we weren't able to follow up at that point, I think, because different priorities, different funding, people being overstretched. But I think absolutely, I think wherever there's possibilities to train people up to be able to provide direct service support, it's always going to make a difference. And it also means that we're not going to have to just think about a reliance on interpreters. And I think that's one of the areas where we kind of fall down a bit, is that people often assume you bring interpreters in and everything's fine. And interpreters can mediate conversations like we're having today, but it doesn't necessarily, it's just, like I said earlier on, it's often a sticky plaster, really, kind of covering up what some of the real issues are around understanding about consent, understanding about financial rights, a whole range of different things, which really what we need is more experts who have the deaf BSL expertise to work directly, whether it's in the CAB, whether it's in legal aid, or in domestic abuse services, and a whole range of public services.
Thank you. Lucy, do you have any thoughts on that?
Just one minor issue from a personal experience to do with CAB and legal aid is that when a deaf woman goes through a traumatic situation like financial abuse, when they contact CAB for support, they don't really seem to understand how to book an interpreter. And so access to support becomes delayed. And it amazes me because I just assume, well, CAB, you know how to support people, but how comes you don't understand how to support someone that's deaf? So just the reported experience, CAB has been quite weak when it comes to supporting deaf women. And this is where a deaf employer working within CAB can make a real difference, because it's that direct support, that direct engagement, And I think that can make a real difference.
Dr. Horton?
I'm just really glad that you've brought up solicitors, and I think relating to that as well is advocacy workers for women and children. We still haven't got children's advocacy worker in the family law system. And this would make a huge difference, I think, to women and children to have access to legal aid. It's a huge issue in terms of, I know there's a review of domestic abuse and civil protection orders as well, but certainly victim survivors in the domestic abuse, the criminal law research, we're talking about once the non-harassment orders stopped, how could they access justice? How could they access, because the abuse would continue, how could they access protection orders so they carried on feeling safe? And many of them were saying that they couldn't afford it. They were falling within the gap that you've already talked about in your committee in terms of being able to access legal aid. But then if they were, the competence of the solicitors, so the idea of having a deaf solicitor, but also that those solicitors could be trained in terms of domestic abuse and women and children's rights is a really progressive one. And women and children have talked about the planets colliding really in terms of criminal, civil, child protection, children's hearing, children talking about having screens to give evidence in criminal law and then being given overnight contact with perpetrators of abuse. And we haven't had time to talk about this, but contact with abusers was a real huge issue for deaf mothers, and the fact that the contact wasn't being awarded safely, that children were brokering contact arrangements, and that there was further abuse of women and children in contact. So I think that bringing those kind of planets together and making sure there's advocacy, deaf advocacy, is really important. So thanks for raising that.
Thank you. Back to you, convener.
Okay, thank you very much. Just before we move on there, just picking up on one of the points that Tess made, the committee highlighted in our post-legislative scrutiny of the BSL Act that there should be parity with Gaelic. And as paying attention to what you're saying today, in regards to that, it would, if there was that parity and if there wasn't that investment in deaf and BSL services, would that help support a lot of what you have said today and what's contained within your report? Yeah. No question. Okay, Lucy, yeah.
Yeah, I think Gaelic speakers have the choice. They can speak Gaelic, they can speak English. Deaf people don't have a choice. And because of language deprivation and the identification of BSL, the learning of BSL, there's been so many challenges and there's no choice there. So there needs to be way more support for BSL users.
Yeah, I was thinking that as well in regards to the preventative work that you've spoken about in that early years intervention, that would cover that as well. And another side to this, and you touched on that earlier, Jemina, is about that education of perpetrators. Now, when I'm hearing what you're saying today, I'm listening about trauma for deaf mothers, for their children. I'm talking about pressure on courts and access to legal aid and solicitors, and all this is because of male perpetrator behaviour. That's why we're doing all this service pressure, the fact that we need domestic abuse advisors for deaf women. So have you been able to share your report with some of the work that's been going on in regards to challenging misogyny and challenging that male perpetrator behaviour?
The Equally Safe Board, we could do more, I think, to talk to those leading on the Caledonian programme, but we have been engaging with those involved in the Equally Safe at Schools work and the challenging misogyny and gender equality work going on there. But I think that the Equally Safe Board, we're seeing that as a way to bring all of that work together. It would just be such a huge difference if we could get education from a very early age and communication rights from a very early age. So there's a lot more to do in terms of the prevention work, but there's a lot of, if some of your recommendations from the committee were taken forward more with the general population and the deaf population, then we're, without doubt, the experience of women and children experiencing domestic abuse would be improved. But hopefully, as you say, the education of boys and young men would improve, and we'd see a shift in terms of healthy relationships. But also, I suppose, new to me was the opportunities through deaf community workshops for all of those in the deaf community, which has to include boys and men.
That we've got a strong relationship with Sign Health, which is a deaf health charity based in England, who so far have only ever been funded to do any work in England. They have a domestic abuse specific service for deaf women offered by deaf women, but they've also started a deaf male perpetrator programme, and they've got sort of two different arms, if you like, to that. One is general awareness raising in the deaf community for both men and women, and others is actually looking to support deaf male perpetrators who have been charged or convicted. So we've shared our findings with them, and they're very keen to support any ongoing work that we do. Even though they're based in England, they're actually very keen to see UK-wide consistency. And one other thing to mention is I have just managed to get some funding recently. Again, it's a very, very small pot of funding, just £9,000, to bring together researchers, including Dr Horton, bring together researchers who have expertise in working around domestic abuse, but working with service providers, with perpetrators, with people with learning disabilities, with people from different racial and ethnic minority backgrounds, to try and identify, well, where are the parallels and where are the gaps in the research that we do, because I'm very conscious that we have been doing research with deaf women because that was an area we identified as critical, because we know that most domestic abuse happens towards women by men. So that's what we decided to prioritise initially, and we've done several projects now. But I'm also very aware that there are lots of gaps in our understanding around domestic abuse support and provision for deaf communities generally. So by talking and liaising with other researchers who've got expertise in working with different marginalised groups and service providers, I'm hoping that then we'll be able to come up with a roadmap for what research is needed, identifying where the gaps are for us in the deaf community, and identifying what the sort of priorities are for research going forward to cover all of those different stakeholder groups, if you like.
That's really interesting, and it's great to hear that that work is ongoing there. So that brings us to an end of this evidence session, and I just want to thank you all so much for joining us this morning. We are going to suspend briefly before we move on to our next agenda item. Welcome back. Our third agenda item is consideration of the following 6 negative Scottish statutory instruments. SSI 2026-74, the Sheriff Court Fees Order 2026, 2026-77, the High Court of Judiciary Fees Order 2026, 2026-78, the Justice of the Peace Court Fees Scotland Order 2026, 2026-79, the Sheriff Appeal Court Fees Order 2026, 2026-80, the Court of Session, etc. Fees Order 2026, and 2026-81, the Adults with Incapacity Public Guardians Fees Scotland Regulations 2026. And I refer members to paper 3. Do members have any comments to make on any of the instruments? Rhoda Grant, please.
Thank you, Convener. It's not so much on the instruments themselves, it's around legal aid fees, because there's obviously increases in those costs, and I'm just wondering if the thresholds for the ability to claim legal aid increases in line with those, so people who might just be at the very margins between getting legal aid or not, those fees could push the costs further up. So I'm just wondering if the thresholds will be increased in lines with the fees. And I wondered if we could maybe write to Scottish Government and just find that out, just flag it as an issue.
Okay, thank you, Rhoda. Are members minded to agree that we write to the Government and ask those issues? Okay, that's fine. Okay, thank you. Do any other members have any other comments to make? Maggie?
Just to put on record, because colleagues will know that I have voted against these orders in the past, that was when the increase was 20%. These are broadly in line with or just above inflation, and I think, well, I'm not going to make any move to vote against them today.
Okay. Thank you. Any other members? No. Thank you. That concludes consideration of the instruments, and we will now move on to private session to consider the remaining items on our agenda. But before we move into private, I want to note that although we have further meetings in private to consider our draft reports, this is expected to be our last public session. So with that in mind, I would like to thank all of the members of the committee, past and present, and of course our Parliament staff. We could not absolutely do this without you, and you have all contributed so much to the work of this committee. And I would also like to thank all of those who have contributed. In particular, I'd like to thank those who have shared their lived experience with us, because they've really allowed us to undertake our work in a much more profound and informed way. So thank you all very much, and we will now move into private.